For example, here in Tacloban, because we are often hit by disasters, we have looked into how disasters intersect with mental health issues. So we've looked into different types of disasters, natural disasters, man-made disasters, and even the COVID pandemic disruption and how it affects mental health in general. There are several research gaps that we can actually look into. And this also, I think one of the things that has to be highlighted also is how mental health manifests among the marginalized communities. Do they even know that they have mental health problems? Or is it just, is it ignored because of more pressing problems in the family or in the household? Diba? Kung yung fever nga or sakit sa ulo ay hindi ka bibili ng gamot, what more if you have this, diba? So parang, sasabihin lang yung, di ba mga Pilipino sasabihin lang, tutulog ko na lang to and then I'll be okay. Bukas wala na to. But mental health problems aren't like that. The more you ignore it, the longer you actually avoid seeking treatment, it will persist. And it might worsen actually. So it's something that many people don't realize, that the more you actually ignore your personal needs, the more it actually makes you dysfunctional in your family, in your relationships, in your work, and in other areas of your life. Yeah, UP has a big role to play in terms of promoting mental health literacy all over the Philippines. It's not just something that we should, advocate for within the campus, but we should also bring this kind of knowledge and understanding outside so that we could normalize seeking help. We could actually help communities thrive and become more productive contributors to society. Typhoons, it's a natural part of being, in the Philippines, especially here in Eastern Visayas. So we have more rainy days than sunny days. And in 2022, for example, even in the height of dry season in April, a natural disaster occurred in Baybay, Leyte and Dabuyog, Leyte. So there was a strong typhoon that has actually caused a massive landslide and killed people. So it was a typhoon that wasn't expected, or a natural disaster that wasn't expected on the month of April. And last year, we also have experienced successive typhoons, but one after another, in the last quarter of the year. And because of this, we actually provided psychological first aid training to persons with disabilities and their families in one of our partner groups in Lauang, Northern Samar. So it was quite challenging how to provide psychological first aid among persons with disabilities because it's a mixed group. So for the first time, I realized that when you give and provide informed consent, it's not as easy as you have to read the informed consent, or you have to make someone read the informed consent, because this is a person who is visually impaired. So how can they read the informed consent? Or another group naman had hearing impairment, so you can't just read the informed consent to them. So as simple as that, even as simple as getting their consent to the kinds of services that you're going to provide was already challenging enough, and has to be culturally and culturally sensitive and specific to their needs. So disaster can actually highlight certain problems that are already existing. When we were stationed in Baybay, Leyte in 2022 because of Typhoon Agaton, one of the recipients of the psychological first aid that we provided was a young teenager, and she happened to had been diagnosed already prior to the typhoon. So she has been receiving free medicines from the RHU. And in one of our psychological first aid, it was mentioned that since the typhoon happened, she has been unable to get her treatment for free because it was not available. There was no stock available in the RHU. So this now raised additional concerns, of course, because now the disaster, because they were living in temporary shelters or evacuation shelters at that time, would actually exacerbate her condition and might worsen her condition. So disasters and mental health, you would see that those who are severely affected or impacted are really those individuals who have actually more to lose. These are the individuals who do not have access to several services. They don't have enough money to be able to provide for their needs. They don't have money to get the adequate services and medical treatment that they have. Hence, we would know that disasters disproportionately affect people. And sadly, people who would suffer much worse are those who are really the marginalized communities. Because disasters are being common, one of the initiatives that we've been trying to do is to train teachers how to provide psychological first aid, train laypersons how to provide psychological first aid, because psychological first aid is not something that only professionals can do. Laypersons can actually do psychological first aid. We've been training our NSTP students to do psychological first aid so that even with the lack of mental health professionals that we have, psychological first aid is a short-term, fast intervention. It's one of the most immediate intervention that could actually provide people. Before you could actually turn over this person to more specialized support. So if you could train more laypersons, lay individuals, to do even the most basic thing, para siyang, if someone is drowning, at least someone knows how to do CPR. Diba? So parang ganun din yung psychological first aid. If there is a crisis situation, if there is a traffic incident, if there is someone na nag-aamok, diba? How can you help calm people? How can you reduce people's stress in that situation? How can you be able to apply the principles of psychological first aid in your personal relationships and improve the situation for the better? So that's what we've been trying to do. We've been trying to make mental health interventions readily available to the public. We're trying to make it easy to do, non-technical, diba? That ordinary people can actually apply to their daily lives.